Hi guys, it's me, Jennifer from the Morris Clan. I am giving an update. We are home from Kennedy's cath surgery. It went great. We got to come home that night. We got home about 5:30 that evening and she slept. She didn't sleep hardly at all at the hospital. She slept maybe 30 minutes total while we were there in recovery. But she slept the whole way home, and she slept the moment we got home, and she ate and then slept. And then she woke up at like 8 o'clock this morning. So she definitely got her sleep, and she's doing great. They said that she'd be like really like tired and not really wanting to be active today, and she's done nothing but be herself. She's napping like normal. She's eating like normal. She's talking up a storm like normal. Trying to roll everywhere. So she's acting normal. You wouldn't even think that she had that heart cath surgery yesterday, believe it or not. But she's doing great. We did get a date. That was the other reason why I'm making this video. Is Kennedy's Hemi Fontan, also known as the Glenn surgery, the second open heart surgery with a HLHS child. We have a date. We have a time. We kind of have a visitor policy for this too. And she goes in May 28th at 7:30 for her Hemi Fontan surgery. Now, we will have to be down there Wednesday, May 27th at 11:30 because we have to do what's called pre-op day, is what they call it, is pre-op day, where she has to get x-rays and blood work and all this other kind of testing done before her surgery on Thursday. So, and they said that it takes about 5 hours for that. So we will be down there all day on Wednesday. We didn't want to be down there all day Wednesday, then turn around, drive an hour and a half home, to turn around, get up at 4:30 in the morning to drive back down to Indianapolis. So we got a hotel close to the hospital so that we will return to after her testing is done Wednesday. We're gonna get some sleep, and then we have to be back at Riley's Children's Hospitals at 6 a.m. before her open heart surgery. The visitors thing they are doing for her heart cath procedure, they only allowed one parent in her open heart. They are allowing both of us to go to her pre-op stuff. And they're also allowing both of us to do her, basically we both can do all her pre-op, I would say, and we both can be there during her surgery. Now, the moment that she comes out of surgery and they take her to the cardiac unit, intensive care is where she will go. Now that she only one of us can go. So the plan is we're going to do it together until she gets to the cardiac floor, and then my husband is coming home. My husband's coming home that day, and I will be staying down there with her. We've heard stories on recovery. We've heard anywhere between 3 days to a week to 2 weeks. I mean, you really don't know what recovery is going to be until you go through it, and every child is different. So we don't have a timeline for when she's coming home or anything. The same surgeon who did her Norwood is doing her Hemi Fontan, which he was amazing, and we absolutely loved him. And you could just tell when he talks to you and when he talks about your child that she's not just another patient. She's, you know, he takes into consideration that he has your child's life in his hands, and he knows that, and he tries his best to be so understanding of your feelings and emotions, and we just couldn't ask for a better surgeon than who she has. If you're from the Indiana area, Dr. Rodefell is her doctor, and he's amazing. So we're about to go through this big open heart surgery again with him, and I don't expect anything less or our feelings to change about him. But for the most part, it's going to be rough. They are allowing parents to switch out, but it's not just like a quick switch. Like if I'm there, I have to be there for at least 2 days and then switch, and then he has to be there for at least 2 days and then switch. They're doing this to, I guess, they just don't want to bring a whole bunch of outside germs in. So unless she's doing really, really well, sorry guys, I live by a busy road. Anyway, my daughter Kennedy is very much a mommy's girl. So my husband basically told me if she's got what's called the Glenn headache, or she's in a lot of pain and she needs a lot of comforting, and that he's just not gonna remove me from her room. He's willing to stay here with our boys and our other kids during that time while I'm down there with her and helping her with her recovery, especially if it's rough. Again, we don't know what kind of recovery she's going to go through. Every child is different. So it's a process. And like I said, I made this channel, you know, to go along with our trying to conceive originally, and we got pregnant right away. And then it turned into a pregnancy channel, and then now this will forever be a hypoplastic left heart syndrome channel, because when my daughter got diagnosed with this almost a year ago, guys. Yep, we're coming to that year mark that we found out that she had this, and I had such a hard time finding information. And don't Google, because Google doesn't know everything, and it's scary. I mean, it really is. So I just tried to find people that went through this, and I did find some, and a couple channels didn't make the same decisions as we did. So like I said, every channel is different, every family is different, and every family makes the choices for their own reasons, and I will not judge a family what they decide to do. So I will take you guys along our journey through this second open heart surgery, which I have mixed feelings on it. We knew it was coming. We know this is part of the road with hypoplastic left heart, and it's just scary because it is an open heart surgery, and there's nothing that we can do to not go through it. Like, she has to have it, and so it's very scary and very nerve-wracking, and it's very different from the first one, because the first one, during the Norwood, my husband and I were able to lean on each other and be strong when the other one just needed to cry. And then, I don't know, it worked for us as her parents and watching her go through this. And now this time, yeah, we're going to be able to support each other through the surgery and talk to the surgeon after the surgery and know that she's okay, or, you know, what happened, or, you know, what's the next step, or God forbid something bad happens. We'll be there for each other. But during her recovery, there's no leaning on each other. There's only me or him by himself if he's with her. There's no leaning on each other. There's just us having to be strong all the time and being there for her. So we'll see how this goes. It's not what we had planned, but what can you do when you're going through this COVID-19 stuff? It's turned our world upside down. So we shall see, guys. just keep her in your prayers, and I will update you guys maybe after we've done our pre-op and tell you how that went. But I know I posted a lot of videos here lately, but I'm trying to keep you guys up to date and up to speed on everything that's going on. So I'll see you all in my next video. Bye guys.